We will discuss anticholinergic drug. Anticholinergic drugs is also called as antimuscarinic, also called as atropinic, or also called as parasympatholytic drug. Parasympatholytic drug. Today discuss that anticholinergic drug. Antimuscarinic because they block the acetylcholine release where in that muscarinic receptor. They block which muscarinic receptor, that's why it's called as antimuscarinic receptor, and their blocker always use atropine sulfate, that is called atropinic. The drug is called as a parasympatholytic, that cholinergic drug, blocked by that agent, that is called as a parasympatholytic agent. Okay, now see, a drug which reduce. What do you mean by the antimuscarinic? The drug which reduce or block, which reduce or block the action of acetylcholine at muscarinic receptor are known as antimuscarinic drug, atropinic or parasympatholytic drug. The drug which block acetylcholine release at muscarinic receptor, and that is called as a antimuscarinic drug. This drug blocked by the muscarinic receptor. Now this drug means antimuscarinic drug. Antimuscarinic drug blocked by the muscarinic action. Which of acetylcholine, where all the peripheral tissue and in the CNS, but do not prevent the release of acetylcholine from nerve ending, The antimuscarinic drug blocked by the antimuscarinic action of acetylcholine where the peripheral tissue and the CNS, but do not blocked by acetylcholine in the nerve ending. However, the nicotinic, now the next action on the nicotinic action. Now acetylcholine act in the cholinergic system in the muscarinic action and the nicotinic action. It has been studied now, you know it, in cholinergic drug, where the acetylcholine is in the nicotinic. But in the nicotinic action, acetylcholine is released at neuromuscular junction. Neuromuscular junction. Atomic ganglion adrenal medulla are not blocked by normal dose of muscarinic anti-muscarinic agent, means atropine. Normal dose does not affect in the nicotinic action. Atropine is used the prototype of muscarinic blocking agent. Muscarinic blocking agent. Okay, now see the classification. The drug classification divided into different class is given below. Now see the classification. Natural alkaloids. Natural alkaloids is atropine. Example, atropine is a prototype drug. Hyoscyamine, hyoscine, that you know the scopolamine. Okay, second class, semi-synthetic derivatives. Semi-synthetic derivatives. Example, homoatropine, methyl bromide, atropine methonitrate, hyoscine methyl bromide. Last, synthetic compound. Example, cyclopentolate, that cause the Madratic, means dilation of the pupils. Such a drug are used. Another example, propanthelene. Such drug is as a antiplasmodic. Another example of such category, oxyphenonium, dicyclomine, common use and antiplasmodic, piperazepine, piperazepines. Okay. And another example of such a category, trihexyphenidyl, trihexyphenidyl is used as anti-Parkinsonisms. The drug used treatment of anti-Parkinsonisms. Now see the classification in very briefly again. The classification is given three types: natural alkaloid, semi-synthetic derivative, and the synthetic compound derivative. Now the natural alkaloids is obtained the atropine and hyoscyamine. Another semi-synthetic derivative, homoatropine, methyl bromide, atropine, methonitrate, hyoscyamine, methyl bromide. Synthetic compound derivative, example cyclopentolate. It caused the use for the pediatric. Profenthylline, oxymorphine, dicyclomine, piperazepine is act as an antiplasmodic in the category, and the trihexyphenidyl is used as a in the treatment of anti-Parkinsonisms. Okay. Now see the pharmacology. Atropine is drug are used. Atropine is act as a prototype of antimuscarinic drug. It is obtained for atropine along with the hyoscine is obtained for atropa belladonna. This is a synonym. Atropine and the other anticholinergic drugs are act as a competitive antagonist means blocked by the cholinergic by antagonist, this by reversibly. The reaction should be as a reversible. It does not block by the nicotinic receptor. It does not block by the nicotinic receptor. It does not block by nicotinic receptor. The action should be block muscarinic action. They are blocked, but never nicotinic action is not blocked. Okay. They block muscarinic action. They produce the muscarinic action. Atropine act on the muscarinic receptor by muscarinic action. They block by the muscarinic receptor and they act on the muscarinic, but they does not block by the nicotinic action. Next topic, pharmacological action. First, effect on serious cardiovascular system. The atropine is caused bradycardia. Why they cause the bradycardia? Due to the central vagal stimulation. And then atropine produce. Then first they produce bradycardia, then they produce the tachycardia. Due to the inhibitory effect. Of vagal effect. That is a vagal effect. Next, the higher dose causing flushing of the face due to direct action of blood vessel. Next, effect on CNS. Central nervous reaction of central nervous system. Therapeutic dose does not. No effect on CNS. The high dose causes central excitement. Central excitation. And then they produce restlessness, irritability, hallucination, delirium followed by the depression. Delirium followed by depression. Okay. And finally pose in the coma. On the next section, effect on smooth muscle. All effect on smooth muscle. First effect in GIT. The atropine abolishes hypermotility of GIT. But does not completely abolish the normal motility, but does not complete abolish the normal mortality. The atropine is cause hypermotility of the GIT. Completely abolish the hypermotility, but does not completely affect in the normal motility of GIT. This action is called as anti-plasmodic action. Okay. This is also caused by constipation occur. Constipation occurs. Second, respiratory tract. The atropine produces bronchodilation effect. Bronchodilation effect. It is used in treatment of. It is some bronchodilation effect. Reduce the another effect. Reduce the airway resistance and reduce the secretion of and reduce the secretion of respiratory tract. Therefore, it has no useful in the stomach. Useless in the stomach. Simple. Usefulness in the stomach. Okay. The next action, effect on next eye. Now the topical application, mean installation. Topical application, mean installation of drug is cause mydriasis. There is dilation of pupils. Dilation of pupils. Pupil may be dilated big. And cycloplegia. The object is very far away, but see the object fell to the. The object is very far away. See the fell to the nearer. That is called as the cycloplegia. The effect is lasting for 7 to 10 days and completely abolish the light reflex. Completely abolish the light reflex. The next will be urinary tract. Urinary tract. Atropine relieves the overactivity of bladder and uterus, and maybe atropine relieve the overactivity of the bladder and ureters and may cause urinary retention. Sorry. Thus, atropine are used for renal colic. Thus, the atropine is used for renal colic, renal pains. Okay. Next effect is exocrine gland. Exocrine gland. The atrophy decrease the secretion decrease the secretion of all exocrine gland that depend on acetylcholine, such as, which are the exocrine gland? Sweating gland. Which are the exocrine gland? Examples such as salivary gland, sweating gland, bronchial gland, gastric gland, pharyngeal gland, and nasal mucosa. They cause the effect: dry mouth, burning vision, and raised body temperature due to no sweat. Body temperature rise because due to no sweat. Okay, but does not affect in what? Not affect in bile, urine, and milk. Okay. ADME: absorption, distribution, metabolism, and excretion. Atropine and hyoscine are well absorbed in the GIT. They penetrate on the topical applications. They cross the blood-brain barrier. They cross the blood-brain barrier. Topical application. Topical application really penetrate in the cornea. Okay. 50% metabolize in the liver, 50% metabolize in the liver, and rest is excreted unchanged form, excreted through the urine. Half-life is 2 to 3 hours. Okay, see the side effects. During the pharmacology, you know the side effects. Reduce the mortality of GIT. They cause constipation, dry mouth, burning vision, retention of urine, retention in urine, dilation of pupils, Violation of people. See the side effects. Okay. The next topic is the poisoning in the therapeutic uses. Atropine poisoning. A question always asked in the annual examination: poisoning of belladonna. Atropine. Belladonna. Poisoning with belladonna alkaloids. Atropine and related drug. Okay. Now that poisoning cause sign and symptoms. Yes. High dose causes or toxic dose causes the poisoning of belladonna alkaloids or atropine. Their sign and symptoms. First, dry mouth. Second, difficulty in the swelling. Difficulty in the swelling and the talking. Okay. Flush and hot skin and fever. Dilate the pupil. Dilated pupils. Burning of vision. Excitement. Hallucination, delirium. Avas. Hallucination and delirium. Hypotension. Serious collapse with respiratory depression. Respiratory depressions. Treatment. Now these are the signs and symptoms. Question will explain the belladonna poisoning. Write down signs and symptoms, then the treatment. The treatment which gives the antidote. Antidote neutralize the poisons, atropine poisons. Those agents are neutralize the poison, that is called the antidote. Is atropine is higher dose cause poisons, and that neutralized by use the antidote as physostigmine. In 1 to 4 mg IV dose. Which has to repeated. Within 1 to 2 hours. Okay. Now, last point of this chapter is therapeutic use of anticholinergic drug. First, it is used as an antiplasmotic. Common use. Free from the plasms in the abdomen. It is used as an antiplasmodic. Atropine and their drug commonly used by the atropine and their related drugs frequently used in the intestine. Second, it is used as these drugs are used to reduce the salivary secretion, salivary and bronchial secretion